day everyone, I am Cheryl Ann Soriano from BSN 1C from PLT College Incorporated. So for today, I will be assessing the eyes, nose, neck, and breasts. Hi Miss Gandangan, so I'm Cheryl Ann Soriano, your student nurse for today. So for today, we will be assess your eyes, nose, neck, and breasts. So shall we start? So ma'am, today I'm gonna proceed to assessing your eyes. So can I touch your face, ma'am? Ma'am, could you close your eyes tightly and then open them up for me? Close. Okay, open. The mumps of the patient has no trouble opening and closing the eye. The eyelids are covering the part of the sclera, which is normal. Now we're going to continue to assess the patient's palpebral conjunctive ache. So ma'am, could you look down for me? Okay, so I'm gonna pull your lashes, okay? Can you blink for me? Now the other side. No swelling, no presence of foreign object, or any pain by the patient as I did check the palpebral conjunctive ache. So now, I'm going to proceed to palpating the lacrimal gland of the patient. Ma'am, is it okay to touch your face? Okay. There seems to be no swelling and everything is normal with lacrimal gland. So now I'm going to proceed to touch the nasal lacrimal gland. So can I touch your face again, ma'am? Please. Do you feel anything, ma'am? No. Okay, so patient feels no pain and there is no presence of the swelling. So now I'm going to assess the conjunctive ache of the patient. So ma'am, is it okay to touch your face again? Okay. So could you look up for me? Okay. Patient conjunctive ache is pinkish in color. There seem to be no foreign bodies or any type of swelling and infection, so patient conjunctive ache is normal. Now for the sclera and cornea, patient sclera looks perfectly normal both in the left and right side, and there are no abnormalities with the patient cornea both the left and the right side, so sclera and cornea is normal. Now we're going to proceed to assessing the patient iris. So the patient iris is dark brown in color, but iris are of the same size. So the normal iris type should be 10.2 mm to 13 mm. So now we're going to proceed to checking the construction of the patient pupils. So I dim the light. So ma'am, I'm gonna check your eyes again. So I'm just gonna shine a light on your eye. Is today with you? Okay. So the pupils are constricting. So the both and the left and right pupils are constricting as it should, and it is normal. Now we're going to check for the accommodation of the patient pupils. So ma'am, I'm gonna shine a light on your eye again, okay? So I want you to look at the object over there. So just look straight ahead. So I'm going to start, okay? Okay, so both patient pupils are still constricting. The left and right both are responsive to the light. both pupils, the left and the right, are still constricting and reactive to the light. So it is normal. It is accommodation and it is responsive to light. So what I'm gonna do is I'm going to show my fingers on the side while one side of your eye is covered. So you're just going to tell me how many you see, okay? Okay, so let's begin. Can you cover your one eye, please? How many fingers are there? One, here, two. Okay. Can you blink for me now? Can you cover your one eye? How many fingers are there? One, here, two. Okay. So patient can identify how many fingers there are. So we're gonna proceed to assessing the nose. So patient nose is in the midline or the face or midline. There seem no deviation to the left or the right. Septum is normal. Both nostrils are normal. So now I'm going to conclude one side of your nostril. So could you conclude it for me like this? Okay, inhale and exhale. Okay, did you have a hard time breathing? No. Okay, now for the other side. Inhale, exhale. Did you have a hard time breathing? No. So patient can breathe perfectly normal even if one side is conclude. So there is no obstruction in the nose. So now we're going to palpate the patient external nostrils or nares. Do you feel any pain when I touch it? No. Okay. Now we're going to proceed to checking the patient internal nerves. So ma'am, I'm just gonna place my hand on your forehead and tilt it back of your okay?
Flashlightan mo, B.
We're gonna proceed to the checking the patient's sinuses and maxillary and the frontal. So ma'am, I'm gonna touch your face again. Is it okay with you? Okay. Okay. So there seems to be no swelling. Is there anything? Okay. We're gonna proceed to inspecting the patient frontal sinuses. Do you feel anything? Nothing. Okay. Okay, so there's no swelling and there is no pain as per the patients. Okay, today I'm going to assess your neck in order for me to know if there are some abnormalities with your neck. This assessment will require me to touch you. Is it okay with you? Okay. Okay, let's start. Height and symmetry. Now I'm going to inspect your thyroid cartilage and cricoid cartilage. By taking a sip of this water, can you please take a sip of this water? Okay, retired cartilage and trigger that will move upwards symmetrically as you saw alone. Now, I'm going to inspect your cervical vertebrae by flexing your neck a little. Can please flex your neck like this? Okay, your cervical vertebrae is visible and prominent. Now, I'm going to inspect your neck range of motion. So, can you please turn your head to the right and to the exposed, we inspect any masses, any lesions, or any abnormal or physical deformities.
We're gonna follow this manner, palpating the breast of the patient, and we're gonna check for any swelling or areas of tenderness. After assessing, I have seen any abnormal or problem or any swelling tenderness.
So for today, I will be assessing the mouth and oropharynx. Good day, ma'am. I am Cheryl Ansoriano, your student nurse for today. May I know your name, ma'am?
Ruth Dangaman.
Okay, so for today, I'm going to assess your mouth to check your abnormalities. So can we start, ma'am?
Sure.
Okay. Inquire if the client has any history of the following. Can I ask you, ma'am, if you have ulcers or presence of lesions?
None.
Okay.
Inspect and palpate the inner lips and buccal mucosa for color, moisture, texture, and the presence of lesions.
So your inner lip is pink, soft, moist, has a smooth texture and elastic.
So, inspect the teeth and gums while examining the inner lips and the buccal mucosa.
So your teeth are smooth and your gums are pink, moist, firm texture and no retraction.
Inspect the surface of the tongue for position, color, texture. Ask the client to protrude the tongue.
So your tongue is in central position, pink color and no lesions.
So, inspect the tongue movement.
Your tongue moves freely and no tenderness.
Inspect the hard and soft palate for color, shape, texture, and the presence of bony prominences.
So your soft palate is light pink and smooth, and your hard palate is lighter pink. So your uvula is positioned in midline of soft palates rises during vocalization.
Inspect the oropharynx for color and texture.
Okay, so your oropharynx is pink and has a smooth posterior wall. Okay, that's all. Thank you for your cooperation.
Thank you.
Okay. For today, I will be assessing the thorax and lungs. In this assessment, we will include the posterior and anterior thorax, and equipments that we will use are the stethoscope, marker, and the tape measure. So, good morning, sir. I am Cheryl Ansoriano, your student nurse for today. May I know your name? So, for today, we will be assessing the thorax and lungs. So, first, I'm going to perform hand hygiene to ensure your safety and myself. And then I'm going to provide the privacy by making sure that all the things surroundings us that are close. So then I'm going to ask you, do you have any history or family history of skin, eye, of cancer?
None.
Okay, so what are your lifestyle habits such as smoking?
I don't have vices.
Okay, so do you have any medication right now?
None.
Okay. So first, we need to inspect the shape and symmetry of the thorax from posterior and the lateral views, and then compare the anterior diameter to the transverse diameter. Okay, so thorax is symmetric, and the next is inspect the spinal alignment for different needs. So sir, can you stand up? So have the client stand from a lateral position and then observe three normal curvatures, the cervical, thoracic, and the lumbar. And then so spine is normally aligned. And the next is I'm going to palpate the posterior thorax. So they are normal, no swelling and no tenderness. And the next is I'm going to palpate the toes in your chest. For respiratory, so certainly make a deep breath. Once again. It is normal and it is move away. Next is palpate the chest. For vocal affirmative, you can use right hand, but I will go and use both hands. So sir, can you say 1, 2, 3 or blue, blue?
1, 2, 3. 1, 2, 3. 1, 2, 3.
Next is I'm going to percuss the thorax and percuss the diaphragmatic excursion. Sir, take a deep breath. Let it out and then hold it. I will do some percussion and take another deep breath. And as I measure, it is 5 cm, which is the expected measurement of the diaphragmatic excursion. The next is I move on to things such as using the galvanized diaphragm of the service stethoscope. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. So the findings is normal. And the next I'm going to pick such as using the galvanized diagram of the service stethoscope. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. So the findings are just normal. So let's proceed to anterior thorax. First is we need to inspect the breathing pattern. So I can see that the breathing is quiet and it has an effortless respiration. And the next is we're going to inspect the costal angle and the angle at which the leaf fender is tied. Costal angle is 90 degrees, which is normal. Next is we're going to palpate the anterior chest. So it's just normal, and then we're going to palpate the anterior chest for respiratory excursion. So it's just normal, and then we're going to palpate the tactile fremitus in the same manner in the posterior chest. Inhale, exhale. Inhale, exhale. So it is just normal. So next is I'm going to percuss the anterior chest systematically. So it's just normal, and then I'm going to palpate your trachea that they are using the stethoscope. Okay, and then we're going to palpate the anterior chest. Okay. And then I'm going to document all the findings in the health record. So thank you for your cooperation.
Thank you.